I am so excited to welcome our new medical director, Dr. Yoleetah Ilodi. And I'd want to make sure to recognize the years of contributions that Dr. Aurora has made as our medical director. And as I sent a letter out to members that he has retired, actually retired a few years ago, and has graciously stayed on with us. But certainly we reached a point where he said, "Okay, are you going to find someone?" But we're really excited, and we've had a chance already over the last few weeks to be working closely together with you as we review the many applications that are coming in the door right now. But I want to really give you the opportunity, Dr. Elodie, to share with our members a little bit about yourself. If I could just let people know that we are recording this session, so it will be available on our website in the member resource portal. And if you want to put your screen in speaker view, you can do that on mine. I think it's in the top right-hand corner, but you have an option between gallery view and speaker view. And if you do that, you'll be seeing her as she speaks. You'll also see her screen as she shares information with us, but it's really whatever your preference is. So without further ado, Dr. Elodie, I'm going to turn it over to you, and you're on mute. So unmute yourself and I'll let you share a little bit about you and what brought you to this work.
All right. Thank you so much, Lynn. Thank you, everyone out there. I can't see you, but I'm just going to imagine that you're sitting in your homes right now, smiling with your nice cup of coffee. So just a little bit about myself. I'm actually from Northeast Ohio, a small little, I don't even want to know if I call it a city, a suburb, Richmond Heights, Ohio. And then I headed to Ohio State University of Cincinnati for medicine, and then right back up to Akron. So I never quite left the state. I have three beautiful children, 18, 8, and 6. A wonderful husband who's also a physician. He is the site director for Barberton Hospital. And so, I did my geriatric fellowship at Summa Health System, and I kind of stayed on there. And I still work part-time there, and I also work as an associate professor for NeoMed. So I wear quite a few hats at Summa, NeoMed, and also Molina. This is my life's work. My mother is a missionary, and she travels the world. So I was in bulk raised by my grandparents, who are the loves of my lives. They're in their 90s, and they are absolutely phenomenal. And I think it was just second nature for me to want to go into geriatrics. I just, it was just natural for me to want to do that. I started working actually at nursing homes at 15 years old, which they thought was very unnatural for a 15-year-old to love her job so much. But it is a passion for me to help folks age successfully in a healthy way, to empower older adults. I certainly continue to empower the older adults in my family, my grandparents, to live healthy and enlightening lives. I don't really have any hobbies. I just love anything that's really around my work. I really just enjoy patient care and educating. I do a lot of mini medical schools in the Akron public school system. So they'll call me in and I'll bring, Lynn has seen some of my fun props. I'll bring my fun stuff, my simulators out in my mobile office, and let the middle school kids just kind of play around and get exposure to the health field. Sometimes they otherwise may not have had that exposure. So I guess that's a little bit of a hobby, but again, it's all fun for me. So that's just a little bit about myself. I love this, what's going on right now in terms of the vaccination. Clearly I don't love COVID, but what's going on with all the trials. And I did have a lot of information in these slides, and I tried to take out the bulk of it because I had preclinical trial stuff and phase 1 through phase 3. And we can certainly talk about that if that's something that you guys are interested in. I think I probably will touch on it a little bit because I'm sure one of the questions that I will get is why so fast? And so we can definitely go over that. So I have a PowerPoint to share if everyone is okay with that. I'm going to go to the bottom, so bear with me just for 1 second.
And while you're doing that, I'll just let people know that anytime they want to ask a question, just type a question down at the bottom. You can see a little box that says Q&A, or there's a chat box. You can type your questions or comments in either one of those. And I've got a couple of team members on with us that are going to help us field those questions, and we'll kind of interject where it seems appropriate. But we'll definitely be available to answer your questions and focus on that as well. So I'm going to turn it back over to you, Dr. Ilodi.
Okay, can you guys see my screen okay?
Yes.
Okay, and now it's not, now it's in a frozen state, so I'm gonna try this again here. Let's see. Technology is great when it works. I'm gonna stop sharing for a second and try this again.
Do you want to send it to me and I can share it?
Yeah, I may have to do that, Lynn. My apologies here.
No problem. Now we can see it now. I don't know if.
Yeah, it's not allowing me to really let's see. Yeah, it's not allowing me to do any of these functions. So
okay.
I'll send this to you. Let me stop sharing my screen.
Okay.
Okay. And it's going to come your way in 2 seconds.
Okay. All right.
Sorry, folks. This
technology, you gotta love
sometimes
it, right?
It's just we sometimes don't get along. So let's see. All right, there we go.
Okay. All right, and if you want to get started out as soon as it comes through, I'll put it up and.
Perfect. So again, speaking a little bit about COVID-19, I kind of just wanted to go through the history of it. So the coronavirus, a little bit of history, of course, is that it started to peak its head in Wuhan, China, in the Hubei, hopefully I did not mess that up as I usually do, Providence, in 2019. And so we know that was what we call kind of like the nidus that started the spread. So it started there and it kind of worked its way from Asia to Europe to the United States. And as we know, it slowly started to sweep across and spread. And so we here in the United States started to see some of the signs of COVID-19 in March of 2020. And I don't know if you guys can remember just the sheer fear of it when it did hit the United States, because none of us knew what this was going to look like. I know for myself, they shut down my kids' school. They go to Old Trail, they shut down their school and they, they shut down all the activities. They shut down the city. And folks started to get the disease, and we have seen that the symptoms of it range from very severe ICU, which is the intensive care unit. And I start with that first because I really never want to overlook those individuals that are currently suffering there. So in the ICU, it goes from that to mild symptoms to absolutely no symptoms at all. I've had patients who I am very surprised when they're positive because they don't even have a loss in smell. They don't have a loss in taste. So the symptoms really range broadly. We know that individuals who have what we call comorbidities, disease states such as diabetes or high blood pressure, cardiac disease or lung disease, are at increased risk of death due to the COVID-19. We also know that there are a subgroup of young folks who we are trying to really identify why is this killing them. We have a subgroup of children and teen and young adults who otherwise are healthy that this disease is truly harming. So we have definitely a large, I want to say gap in our knowledge base, but we do know that if the more comorbidities you have, more disease states that you have, the more likely you are to have chronic disease or what we call sequelae from it. So I talk a little bit, I don't know, Lynn, if you were able to get that PowerPoint up.
I am. I'm just not able to share it yet, so I'm working on it.
Okay.
It's here. I did get it. Now it's here, so I'm working on it.
No problem. So a little bit about just the prevention, which I know that you guys are all already doing that. So a little bit about the prevention of the spread of COVID-19 is washing your hands, using hand sanitizer, wearing a mask. We know that it is spread via droplets. If we have some type of droplets, sneeze in our hand or cough in our hand and we touch something, we know that it can live on the surface for a certain amount of time. All those surface times are different. So we continuously sanitize our surfaces. I can't tell you how important it is to wear a mask and stay 6 feet apart. Yay, Lynn saves the day. Thank you.
Yeah, except I'm still not sure I can advance the slides or move it out of this. For some reason, it's not allowing me to get into it. So we'll keep going and I'll keep working at it.
Oh, no problem. No problem at all. So again, I just wanted to kind of touch base on just the spread of it because I know everybody's doing a great job doing this. But it's something that we have to continue to do. And really that is going to be how we stop the spread of all of this in the vaccine, which is what we're going to talk about today. So a little bit about the vaccine. So right now we have one vaccine that has been 17-4 votes by the FDA advisory panel has been recommended for emergency authorization, use authorization. And what that means is that on Saturday, the FDA will vote whether or not they're going to use this for emergency use. When they first send out the vaccines, they're going to send out approximately, and I'm going to get this number right this time, they are going to make 6.4 million vaccines. But they're going to keep 3.2 million of those vaccines because of the individuals that they're still studying. We know that the vaccine so far, is, here we go. Thank you, Lynn.
You're welcome.
And if you can actually go towards the end of it, because that's where I talk a little bit about the vaccine.
Okay.
This here is just me talking about the surface and, oh no, this is a good one. So actually I'm gonna stop right here and I'm just gonna rewind a little bit.
Okay.
This right here, I just pulled this because this is so important about the global cases. It's 69 mil, almost 69, almost 70 million cases, global cases of coronavirus. And we have 7.5 million deaths. I know a lot of things happen around the world, but this is really hitting home for me. This is happening right in our backyard. If we can look at the cases, if you stroll down just one there's the United States has 15 million, a little over 15 million cases, and we have close to 290 deaths, 90,000 deaths. And I highlight that because we have to remember the importance of why we need this vaccine. So if we can hit the next key. So I did this by age group, and you guys can all access this information. I get my information from the World Health Organization as well as the CDC. And as a geriatrician, I'm interested in knowing what is it doing to our older adults. So I wanted to look at the cases by age.
Oh, sorry.
That's okay. So here by age, if you see here that individuals over the age of 65, it's almost 13 to 14%. And that's a pretty big number. But if you look at how many people over the age of 65 that is affecting in terms of death, you're going to see the bulk of that. You see the age group 65 to 74 is 20.8%. And then again, if you go up, that's 27.1. And then over the age of 85, 32.6. Okay, so again, we're talking about, over 80% of our deaths are individuals over the age of 65. Next slide, please. And so this information is, so of course, I've always got to bring up Ohio. So this is Ohio's information. We have 531,850 cases. Deaths are 7,298. That's huge. Again, just looking at the deaths that we have right here in Ohio. My husband, who is on the front line for all of this, he runs a COVID unit. He says, why can't we just shut down for 2 weeks, 2 straight weeks, because he's seen so many of these deaths. SUMA at this time has, SUMA Health System, we have 170 individuals in the hospital with COVID. And that's with us trying to keep them out. So that's with people, that's with very, very sick people. We're working with oxygen companies to send most people home because we just don't have the capacity, and we have to be open to the smaller hospitals as well. So I say that because sometimes, like with any field, if you don't see it, maybe it's not happening, but it's very much happening. And it's really affecting a lot of people. Next slide, please. So again, prevention measures, we'll just quickly go over that. Antibiotics do not work against coronavirus. So one of the things that I do on the side as well is telehealth. And I can't tell you how many times I get the call that I have a headache and a sore throat and a dry cough and I'm a little fatigued. And I'm like, well, you need to get tested. And they're like, no, can you just give me a Z-Pack? Not the answer to that at all. Antibiotics, it's a virus. Antibiotics do not work in very case-dependent cases. There are times where I will give an antibiotic, and that's because they have other things that are happening, other illnesses that are occurring together with the coronavirus. Next slide. We talked about the importance of social distancing, covering your mouth when you sneeze or cough. And if you have any symptoms, make sure you get medical attention and that you get tested. Next slide. So I want to go on my soapbox just a little bit. I did this yesterday. So sorry, Lynn and Marla, for repeating myself. I can't tell folks how much a lot of people are doing this know before you go to holiday family settings, parties, whatever you want to call them. So important to understand that just because you're negative at one moment doesn't mean that you're not going to be the next day. So it's so important to continue to socially distance, to stay away from big gatherings. And I call big gatherings anybody that's not in your household. If they don't live in your household, then it's a no-go. And I say that because, and I know how much it's hard. And I say that because I miss my grandparents. I was raised by them and I miss them very much. But I keep a distance because it's safe for them and it's safe for me. But again, I worry more about them. It's safe for them. And it's not great for them to be around me, and no matter how much I miss them. So next slide. So I put this, and I know this is very elementary, but again, a lot of people, I watch folks the occasional times I actually get to go to the grocery store. Most of the time I'm ordering my groceries, but I watch people and the way they take off their mask. So before you even put your mask on, you want to make sure you wash your hands. You don't want to touch your face, okay? Because we have all of these particles and germs on our hands. We want to make sure that we always grab the mask kind of like by the earpiece. That's a scrunchie, so sorry, but by the earpiece, okay? And we want to make sure we put it on. And after we put on our mask very carefully, we want to wash our hands again. When we're taking off our mask, we want to do that same type of procedure. We want to wash our hands. That is so important because anything that is near our face, we want to make sure that our hands are sanitized because that is exactly how this virus is spread. All right, next slide, please. Okay, so this is such a delicious article that just came out yesterday. I got so excited about this. So yesterday was a day-long meeting with the FDA advisory committee. So it was 21 scientists, experts in the field, physicians, statisticians, just sitting in a room with the government asking all kinds of questions. So this was absolutely great. And it was a vote 17-4 to approve the use of this vaccine. The study they started this study off 11 months ago. And how studies work is preclinical, where they take little tiny mice and they give them the vaccine and they expose them to the actual virus. They want to make sure in these trials that the vaccine is just not toxic. They just want to make sure it doesn't kill anybody. The phase 1 is when they say, okay, it didn't kill anybody, let's test it on primates. We just a little bit of primates. And then phase 2, they get a little bit of humans. They want to check the dose, make sure the dose is right. And then phase 3, that's when they bring in the almost 41,000 people into the study. Okay, so they bring about 41,000 people into the study. And that's exactly what they did for each trial. They did not skip a step. We were lucky because I don't know if you guys remember SARS-1. That was probably 2005, 2006. So we had all of this data from SARS-CoV-1. So this is called SARS-CoV-2. We had all of this data already for SARS-CoV-1. And we had this data for the Middle Eastern respiratory disease. So we already had a large pool of information to pull from. So everybody will ask, well, how did this happen so fast? Well, we were already working with a large pool of information. And we already knew how to target what we call the antigen, the germ. So that's how these things occurred so fast. We had a little bit of history there. So again, during these studies, what they found is that the vaccine is safe. Folks did have fever. There was some fatigue and headache from the actual vaccine, but usually those symptoms lasted for about a day. We are still waiting for the approval of the FDA on Saturday. But usually if this panel recommends a drug or vaccine, the FDA agrees, and within 24 hours, the vaccine will be shipped out to hospitals. The thought is that the first line workers, healthcare workers, so not someone like me who I do a lot of administration, a lot of teaching, but I'm not exactly first line, but our first line physicians, nurses, EMTs, etc., will be getting the vaccine. And so after they receive the vaccine, the other group of people are long-term care. So anybody who is in settings, any type of large group settings over the age of 65. So that includes long-term care, assisted living, anybody living in any type of tight-knit group. We include jails in that, any type of prisons, anything that has a large group of people, and anyone that's over the age of 65, we include in that group. And so the next wave of people after that will still continue to be healthcare workers, not so much on the front line, but folks who are maybe outpatient. And then we're going to try to get the rest of the 65-year-olds who are maybe not in congregate settings. The hope is to have this wholly fleshed out by April of 2021. Right now, we only have 2 months of data, but by April 2021, we will have a whole 6 months of data of being able to monitor it to see what this vaccine does. So again, 95% effective in preventing coronavirus. So again, we have 2 doses that they're going to give. So after one dose, after the first dose, 2 weeks after that is 52% effective. Then you get a second dose at the 21-day mark. And then after that is 95% effective. So we see that it's effective even after that first dose, which is great. And then we receive a second dose. There are other vaccines coming down the pipeline. Like I said, there are about, there's a total of 3 that are coming down the pipeline. And again, the one that's coming on Saturday, hopefully, keep my fingers crossed, is the one from Pfizer that you'll hear the most about. So I just wanted to give you just a little bit of information about it. Again, I know it's a lot of information, but I'm happy to answer any questions that you may have. And that's just a little bit, again, about what we just talked about, the partial protection.
We have a couple questions, Dr. Ilodi. I don't know if we lost Lynn there, but I will step in. Someone is asking, should we wear goggles or screens over our eyes when we go amongst other people?
So it depends how close you are. It's not necessary to wear the goggles in the screens. For example, I wear goggles when I go in to see all my patients. That's something I do because I'm very close to them, examining their heart. But if you're going to stay about 6 to 10 feet away from them, then it's not necessary. But if it makes you feel comfortable, I never stop anybody if they feel comfortable with that.
Another question is, this person cannot take flu shots because they had Guillain-Barré. The other day, they heard on the radio that the vaccines have been developed on an influenza platform. Do you think it's likely that I won't be able to get the coronavirus vaccine either? I asked my respiratory therapist this, and she said she couldn't tell yet without specifics about the actual vaccine availability. Do you have any more insight than she?
So that is a great question. So as of right now, so I'm going to kind of diary some of this information that I have. So this is brand new technology, and that's probably why she could not answer the question. This is brand new, never used before technology. So it's not on the influenza platform at all. This is not made out of live or inactivated. This is made by what we call messenger RNA. And basically, we are all made up of DNA, and in our bodies, we have something called RNA that helps replicate that DNA. So basically, they make a germ sequence as an RNA, inject that, and then your body makes that antigen. We call that a spike protein, and your body learns to attack it. So this is not the same influenza platform. So my thought is that people who are allergic to influenza vaccines typically will be okay with an mRNA vaccine. But again, this is new technology. And so if you were my father, mother, I would say, let's sit back, see how it does for the next month before you get it. There has been a couple people, because this was introduced December 2nd in Europe. There's been a couple people who've had kind of like an anaphylaxis reaction. So I would just, if you had any type of reaction to any vaccine, I would just kind of sit back and monitor to see what's going on in these different pockets of populations.
Okay, thank you. I'm back, Marla. Thank you for stepping in there. There's some issue with manipulating screens when you have all these things going on. So when do you think that Kendal at Home members, I know there's a lot of discussion about how this is going to be distributed and older adults being at high risk, but when do you think that Kendal at Home members that are living independently in their homes which round will it be, round 2, round 3, when they're going to actually phase 1 or 2 or 3 that they'll be eligible to get the vaccine? And will they need to go through their primary care physicians, or what would be the next step?
So that is a very good question. And I'm going to say right now, we actually don't know. So the next step, so after the FDA, there's a lot of steps after the FDA finally approves it. Again, yesterday was just like this advisory panel that the FDA listens to. Right. So the FDA says, okay, we approve it, it's going to go out. Then the next is an advisory group called the ACIP. And they're the folks that give the guidelines of who does it go to? Who does it? We know that it's going to go to first line workers. We know that it's going to go to long-term care folks. So we don't know yet. They have hypothesized that the next group of people after this first round will be individuals over the age of 65. And they are thinking that's going to happen late January, February. But I can definitely, once we get more information, that happens on Sunday. So once the FDA approves it, ACIP gets together on Sunday and they will make recommendations. And I can definitely get that information out to you.
Okay. And do you think it's likely that those will be done in public settings, like much like the testing is being done, or will people have to go? Who will get the vaccine to even distribute it? Will it go to clinics of some sort?
So it's going to go to hospitals. It most likely, again, with such a small supply when you look at it. So it's going to go to hospitals first. And then after it goes to hospitals, then they're going to send it to outpatient settings. However, they don't plan to sell it. They don't plan to sell it to hospitals until April 2021.
Okay. I know that we talked about it. I think I know what the answer to this question is going to be, but we talked about not gathering with people outside of our own homes and that type of thing. What are your recommendations around travel for people? It's winter. A lot of our clients go to the warmer climates for the winter. Some people probably do want to travel and be with family. What are your thoughts about travel right now?
Well, it's a hard one. I would say if it's not essential, don't do it. I've had a couple people who've had no choice but to travel because of deaths or births. They're not
Mm,
like, I don't care, COVID, no COVID, I'm not missing my grandchild being born. And I get that. And I'm like, please pack your hazmat suit. Thank you. Again, if it's not essential, don't do it. If it's, we have one guy who's traveling, he's got end stage cancer. He's taking that risk.
right.
I get it. And sometimes you just got to do what you got to do. But unless it's essential, I would not do it.
Okay. What about if someone has bronchiectasis? Does that put them at higher risk for COVID?
Absolutely.
Any kind of respiratory?
Any respiratory, especially something that is going to cause a lot of sputum or a lot of like gulk like that, it could definitely cause worsening, and they can end up in the ICU. So stay away from people, far away from people.
Okay. Okay. This next question is, how long is a negative test good for? So if you have to have a test, you're having a medical procedure or something. So pre-hospitalization, how long is that test good for? That day?
That day, that moment, I always say it's my and I'm going to go on my soapbox land again. But so my brother plays for my stepbrother plays for New Orleans, and they get tested every day. And I'm like, but they know that it's only good for that moment, that
Yeah.
very moment. And it's not even, I wouldn't even say for that day, just that moment. You could be positive 2 minutes after that. Again, it just decides when the virus is going to rear its ugly head.
Yeah, that's the uncertainty around it, and the fact that many people could have it and are asymptomatic and we don't even know. So, and
Yeah,
those
yeah.
those people aren't getting tested normally. So,
No.
yeah. Okay, and the next question is, can you be more specific about at what point a person who has tested positive for COVID needs to go to the hospital? Also, I read in a recent info from Kendal at Home that providers are now available for in-home care to COVID positive patients. Can you tell us what that looks like? Thanks. So I can answer the second part of that, but I'll let you answer the first part about at what point a person is tested positive needs to go to the hospital.
That's a really, really good question. And so right now, if you are having fevers, if you are having any type of respiratory distress, if you're feeling short of breath, then you need to go to the hospital. Now, to be at least evaluated. Now, you may get to the hospital and they may put the pulse ox on your finger and they may see that you're doing well. And in that case, run home. You don't want to be in the hospital. There's a lot of sick people there. So those are the people that they're keeping is when your oxygen drops and people who have a really high fever because they're going what we call septic. They have to monitor their respiratory status. Everybody else they're sending home. Again, if we kept everybody in the hospital that had COVID, there would be no beds. Right now, we're taking our non-COVID patients and they're being seen at Children's Hospital. That's how bad it is right now. So if you even think that you're not feeling good or you're fatigued and maybe you're just, I use the word, you feel like you've been hit by a truck, call the doctor and let them kind of weigh your symptoms. It's nothing wrong with just being cautious and making sure that, you're okay to stay home.
Okay. Perfect. Thank you. The second part of that question has to do with whether or not our providers are caring for our members who are COVID positive. And I would say that initially, the only members that we had testing positive were those that were already living in congregate facilities. So, for example, in nursing homes. But over the last few months, some of our members in their independent homes have tested positive, and in some cases, even a caregiver have caregivers have tested positive. So we obviously are doing our very best to make sure that anything we become aware of, there are notifications made to everyone that's involved. Some of our providers are actually providing care to members who are COVID positive, and we're helping to support them with PPE and making sure that infection control protocol are being followed and that we're minimizing the risk as much as possible. But there are some providers who simply are not able to provide that care. And as you can imagine, caregivers who have children or responsibilities caring for others at home may often not want to put themselves at risk. So we are working on this on a case by case basis. But for those that have tested positive that are in need of care, we have been able to support them at this point. And, I will say that there are some members who have tested positive who have not needed care and have done okay independently. And the care coordinator maybe is supporting them in other ways to provide what they need. But there are a multitude of factors that impact whether or not we can provide that care and what that will look like for every individual. But so far, we haven't seen large numbers. I think less than 10 of our members over this period of time. So we hope to try to keep that to a minimum, and again, encourage our members to reach out to their care coordinators if they're concerned about risk. And, you talked about the grocery shopping and doing it online, and we certainly encourage everyone to do that. I know our staff have helped many of our members get set up so that they don't have to go out unnecessarily. Next question is from my friend Linda in Boston, and she's asking about traveling like in March or April from Boston to Savannah and renting a cottage with her family, wondering if they will likely have had the vaccine by then, or is it something that might delay that travel? And one thing I think about in that scenario is even if she may have had that vaccine, or she and her husband may have had that vaccine because they're over the age of 65 and are in phase 2, that doesn't necessarily mean that the other family members who would be gathering have had that vaccine as of that point.
Yeah, and that's a really tough one. We know that in April it's expected that they're going to start selling it to retails, CVS, Walgreens, etc. It's for individuals that are 16 and up. So there's not a lot of data, and so that was the other thing. So I think I saw a brief question too that I can kind of make this a two-parter about why did the 4 people voted against it. So again, so the 65-year-olds and over, they'll have the vaccine, but doesn't mean that other folks will have that vaccine, and especially if there's little people, because we know little people, they'll get it and they'll just carry it and they'll just spread it.
Right.
They feel perfectly fine. They're just, they're just little people.
Right. We have quite a few people who are asking if they should get a pulse oximeter, and I know we have purchased a few of them to have at the office in case we needed them, as well as thermometers to make sure that for folks who don't have anything, that we can provide them if they needed that. What are your thoughts around that? And even if they had a pulse ox, what triggers going to the hospital? That question's coming up as well.
Yeah. So, and I'm not. I think that if you can have access to a pulse ox, that's great. but there's nothing like your body telling you you're short of breath. Because if you're short of breath and that pulse ox reads like, I'm gonna say normal, that's just because it has not caught up yet. It's gonna take some time for your fingers to feel the low oxygen, sort of say. Your lungs are gonna feel it first before your it's gonna come and be projected on your finger. And so what I have to do, what I have to say about that is trust your body, and that if you're short of breath, regardless of if you have a pulse ox or not, it's time to call the hospital and get going. Okay. And you need to get a chest x-ray. So there's nothing wrong. I sent one over to my grandparents, but again, I always say just trust your body. And if your body's not feeling right, then that's when you need to go in.
Good. And somebody was asking about the just for anyone who might not know, the pulse oximeter is the little device that just clips onto your finger.
I don't know if I have one.
She probably has one in her bag of tricks.
I do, but yeah.
Just don't pull out that arm again.
I know, it's always sitting next to me and I always think about you. I'm like,
it's her props. She's got that crazy sense of what's fun here. Someone else is asking, they have rheumatoid arthritis and are they at higher risk? I would guess anyone with any sort of autoimmune it's always at higher risk, right?
yeah, and especially a lot of times they're on biologics like Humira, or maybe they have prednisone, and all of those things decrease your immune system.
Right.
And so I would, they would be definitely, first in that second phase. And again, they're trying to continue to make this new technology with the mRNA. And by the way, I did not ignore that second part of the question with the 4 people. Why did they vote against it? It's because the one person voted against because of the age. They started the age at 16, and they felt like it just wasn't enough data. There just wasn't enough information to start it at 16 and say individuals over the age of 16 can get the vaccine. They didn't agree with that. Other folks disagreed with the other 3 were because it's new technology, and they question we only have 2 months worth of data. Everybody else at 17 are pretty much saying, look, this pandemic is killing people and we have to get something out. We have 95% effective, that is effective. And so we have to go with it. And so just a little bit of background, they placed 40,000 people, random people in this trial. They split those people in half. 20,000 got the vaccine, 20,000 got what we call a placebo, a blank. And out of that, 170 people naturally got COVID. And so they said, okay, out of the 170 who got COVID, how many were the people who were vaccinated versus the people who had the blank? And out of that, 8 people with the vaccine only got COVID, and it was very mild symptoms. And the other 162 were placebo.
Oh,
and
wow.
How they were able to do that trial. So that really showed just in a natural way that this vaccine is very effective. Do we need more data? Absolutely. Absolutely. But the 17 people say this is killing people and we need to do something. And I would have to say I agree. I don't know all the little bits and pieces of what's going to happen down the line. I definitely will continue communication though.
Great, thank you. I think from a proactive standpoint, Ruth's asking, are there things that we can do to help boost our immune system? And I think, we talk a lot about taking all the precautions to be safe, but are there other things that we can do that really help us fight off, or maybe, as you talked about, even if someone gets it, not quite as bad? What types of things could we be doing from a health perspective?
Yeah, so I love that question. It just reminds me so much of just food being medicine. As I was always, my mother being a missionary, she would say, food is medicine. And so keeping with your berries, things like I don't know why I always think of blueberries, but any type of berry is very good. Anything that has a lot of vitamin C in it. I would not tell you to go out and buy a vitamin C because it's not the same. It's you want to get this from your food. You want to have a balanced diet. You have to have all of those bits and pieces. And again, I would get that straight from your diet. So really just having a balanced diet and exercising. Those are going to be the two biggest things that are going to keep you healthy.
Can't get around that exercise, I'm telling you.
You can't get around the exercise at all. Blood flow is so important.
It sure is. You know, one last question here from Sarah asking, she said, it's almost the opposite of what we talked about, her understanding that you shouldn't trust your body if you have COVID symptoms and don't have any respiratory distress and your pulse ox shows low oxygen levels, that you should still seek medical attention in that case.
Absolutely. I would say so. But again, so, I guess my question would be if you're checking your pulse ox continuously, I don't know if you guys have ever had somebody who's ill and you're watching their vitals in the hospital. I know I've had, and there's no TV, the little vital thing, that's my TV, and I'm sitting watching it. And at any certain time, our vitals can fluctuate. So, but if it's consistently low, I would say absolutely, you still want to go to the hospital, but it's not something that is likely to happen without you having symptoms.
Good. Okay. I think that it's so enlightening to listen to you and hear your perspective on all this. And I hope that it helps people to feel more comfortable about that decision, whether or not, I mean, we see the large percentages of people who say that they don't feel comfortable with this vaccine right now. And hopefully as it rolls out over these next few weeks and months, that people begin to see that it is safe and effective and feel comfortable doing so, so that life gets somewhat back to normal and we can be together again in person. But I think we're all hoping and praying for those things to happen sooner rather than later. So I greatly appreciate your perspective on this and hope that it helps everyone to feel a little more comfortable as we go forward. And as you heard, Dr. Ilodi said she will keep us informed of any recommendations from her perspective, and we'll be sure to pass that information on to each of you to keep you as informed as we can. And I don't know if you caught on to some of what she talked about in the beginning about empowering each of us to be able to make good decisions about our health care. And that's something that's so critically important for all of us and something we'll be focusing on in our conversations with Dr. Ilodi. And Medical Matters will continue, and she'll be our host for those sessions. So we've already begun planning for that, and she's got lots of ideas and thoughts about how she wants to approach that. So we hope that you'll come back and join us and get to know her and really appreciate the perspective and the immense knowledge that you bring to the table. So I want to thank you, and we're so happy to have you on board with us and moving forward with us. So thank you, and thanks to
Thank
everyone for
you.
joining us today.
And I saw Marion Walk. She says, will mask and social distancing be required once the vaccine is received? And that's a yes.
I have a feeling those masks are going to be with us for a while, right? Oh, unfortunately, I guess there's worse things in life. There's lots of people welcoming you as well. So I wanted to make sure that everyone had a chance to ask those questions, and we'll have lots more opportunities to talk with Dr. Ilodi in the coming months. So we appreciate everyone being here. We hope everyone has a great weekend and a safe and healthy holiday season as well. Thank you.
Thank you. Bye-bye.
Bye-bye.